I'm Dave Story. I'm currently President of the College of Anaesthetists. My day job is Professor of Anaesthesia at the University of Melbourne and Head of the Department of Critical Care, and I do my clinical work at the Austin Hospital in Melbourne. I stay away from the technical side of things, although that's often what interests us, in providing clinical anaesthesia. But the way I say is, our job is to keep people alive during surgery. And it's more, if people ask more specifically about what we do. But, I say I'm an anaesthetist, and I think often people still wonder what that is. But if someone asks me, I say, what's your role? My opening line is really, our fundamental job is to keep people alive during surgery. And then I might go on from there. But often, it's with, my mum's just had hip replacement. So did they have a spinal? Or, it's often talking about that individual situation rather than trying to give a broad description of anaesthesia. My personal approach is that at the end of a discussion, so part of the discussion and building trust. And part of that will include saying to them, do you have any questions or concerns? So patients may not say, I don't have any questions, but I'm concerned about this. And I think that's an important component. And then, I'll say to them, I will look after you. That I, as an individual, with my training and as a specialist anaesthetist, I will look after you. And I think that building of trust is part of the conversation, but just trying to reinforce that, I will generally try and care for them to the best of my ability, I think is probably the most important part. For a person to be a good anaesthetist, they need to be calm, particularly in emergencies. They need to understand themselves. They need to deal with, at times, considerable stress. They need to be good communicators. Although, people often joke we're bad communicators, but the reality is that anaesthetists have to be, with patients, but also particularly with our surgical colleagues, particularly if there's a problem. And sometimes have some very frank discussions about what is in the best interest with the patient, maybe with the patient, maybe with their family, maybe with clinical colleagues. So I think there's that component. The ability to think in terms of probability, how we deal with the uncertainty of day-to-day, particularly high-risk patients, and that understanding of how you change your decisions as time goes by. You might start very confident with what's going on, but then you might become less certain, and you need to think about the probabilities of what's going on and how to deal with it. With all the other things I do, both my college roles and my university roles, I call being in theatre and, often with complex cases, my happy place. It is an environment where you're providing care to one particular patient at a time. That's one of the things I really enjoy about anaesthesia. You've made a professional and moral contract with that individual. You've talked to them before their surgery, you've talked about the plan, you've tried to build trust with them, and then you provide the care one case at a time. And that's one of the things I really enjoy about anaesthesia. And I enjoy the collegial and all the people you work with every day. So I was at theatre yesterday, and so we've got the surgeons, the anaesthetic nurses, trainees, the techs, medical students. There's a whole lot of people involved in caring for these individual patients one at a time, and I really enjoy that component of the job.